Welcome to Bite Size Dental Marketing. Nice bite. I have Nick with me. Thanks so much for joining me. Most of the offices we have want to sell higher end treatment, and who better to sell higher end treatment than the guy who sells 24, 27, $30,000 arches every day? How did you get started at Archpoint, and talk me through just your overall approach?
Well, thanks for having me on the show, and I've been looking forward to taking that bite out of the marketing intro all day. So that was the only part I knew that we were doing today. I had no idea what we were going to be doing, so I was looking forward to that. But yeah, so I got started in this 8 years ago, and I used to be in banking, and then I went off and started a restaurant, had an internet company, and I had a friend reach out to me and say, "Hey, you're having a family." Dentistry, a lot of dentists work 4 days a week. You should look at doing this. And I was like, 4 days a week? That sounds pretty good. So that's actually what incentivized me to look at dental. But the company that I went to in the beginning when I first started, they looked at me like, hey, this isn't the normal hire that we hire. I had a finance background. I have a master's in business and accounting background and engineering background as well. But they like that I can talk about money. And
Hmm.
that's the biggest part that people struggle with when talking about $30,000 to $40,000, $50,000 cases is they get shy when it comes to money because they turn over and they get scared when they go to the patient and say, this is $50,000 because it's a lot of money for anybody. I mean, even
Right.
wealthy people, $50,000 is a lot of money to do a full arch. So that's one of the hardest parts for somebody in this position to get over is being able to talk about the money.
Now, I guess it's because, as me at maybe an early stage in my career, or I mean, even now, I have trouble getting around why someone would have $50,000 to spend on their teeth. Is it just I look at it and that's a huge amount of money to me, so I wonder why anyone else would do it, or is it what do you think
Yeah.
it is that makes them scared to talk about money?
Yeah. Well, so it doesn't necessarily make the patient scared, but I'm talking about the treatment coordinator, right? The
Yeah,
treatment
yeah.
coordinators are scared to talk about the money because, especially if they've never done it before. And
Okay.
when I was working in banking, I was in aircraft financing, so we were talking $50 million on a deal, right? So to me, 50,000 actually was a smaller number
Mm,
when I got into this, but for some people, they're used to being in a general dentist office and you're talking about a treatment of a filling or something and it's $300 or it's a cleaning for $150 to $200. So they're used to these smaller numbers or crown for $2,000. So going in and saying, hey, your treatment's going to be $50,000 can be a little nerve wracking to them because it becomes personal, right? Like if you are being told, hey, you need to spend $50,000 on your mouth, you're like, where is that money going to come from? And all these things are going to start going through your head of
yeah.
what's my spouse going to think? That's the price of our car. That's the price of our first home. And that's a lot of things that we hear from these patients because it's a lot of money that they're investing in themselves. Now,
Yeah.
for a lot of people though, it's if they've been in dentistry for a really long time, as far as I'm talking patient now, and if the patient has had a lot of dental work done over the years, this conversation is a lot easier because they know that getting medical work or dental work is not cheap. And
Mhm.
the difference between dental and medical is dental, you're paying for it out of your pocket. Even if you have insurance, it's just a discount program, right? So
Yeah.
insurance doesn't pay hardly anything for care, oral care. So medical is very expensive. People just aren't used to paying for it because they have medical insurance. But when they have dental insurance, they don't help pay for anything. So somebody that's had a bunch of root canals or a bunch of crowns or fillings, they know that it's costly, and this is actually a true investment for them because every year they're being told, "Hey, it's another 3 grand, it's another 5 grand," and it all adds up to more than doing your full arch.
Right, right. Yeah. So walk me through what you like to see in an ideal patient that comes through Archpoint. Are they educated on the procedure? Are they not? What questions do you like to hear? Kind of talk me through your dream scenario of how someone becomes a patient.
Yeah. So what I love about this position is being challenged, right? And I kind of mentioned in the beginning, my undergrad was in engineering, so I started off in engineering, and so I love to know about every aspect of everything that I do or get involved in, which the people I work for or work with sometimes don't like that because I want to know the why, right? That's always my question is, why are
Right.
we doing that? Why are we doing this? And I love all the technology and all the different materials that we use. And so I love it when patients come in and they've been to 10 places, maybe not 10, but a lot of patients have done their research and they have a lot of great questions because I don't always have the answer, but I will get the answer because I want
Mhm.
to learn. And so I've been doing this since 8 years ago, 2015. And, I've learned a lot over the years because I get to work with very intelligent doctors and I get intelligent patients that ask me intelligent questions. And so I have to go find the answer. And so that's how I learn is by being challenged every day.
Mhm.
So I love it when a patient has done their homework. And for some people they might not like that because they're being challenged, but I like it. So I do like somebody that's challenging me. I like when patients have been through dentistry, so they've had dental work done before. It's hard when you look at somebody's x-ray and the patient's never had a filling, never been in a dental chair, never had a cleaning before, and they're losing all their teeth. Those are the hardest patients to work with because they've never been around dentistry before. The
Mm.
ones that have had a bunch of root canals and a bunch of crowns and they've been in the dental chair and all that stuff is starting to fail on them, those patients are more the prime patient because they know what they're getting into, right? They've been in the dental chair. They know that this is a true investment because they've spent a lot in the past trying to do this cosmetic dentistry or saving their teeth and realizing at this point it's starting to go, which is
Right.
unfortunate, but that's what that's the reason that, so many people are in dentures and so many people are seeking out this treatment.
Mhm. Mhm. Yeah. Now, do you find that there are people at different stages of their life that are more inclined to look for implants and, implant supported dentures? Like, are they divorcees? Are they going to a wedding? Are they like, what do you see as the common why that they're choosing now
Yeah,
to get
no,
it
that's a
done?
great question. So it's different across the board. I used to say, our typical patient was, 50 to 70 years old. That used to be it, and that was 8 years ago. Times have changed. We've got every type of patient, every age of patient, every demographic that you could think of that comes through our office. I mean, we have everything from children that are born with a disease and we start seeing them when they're 8 years old and we follow them and help them get to a point where they're 17, 18 years old where they can do implants, or somebody that's um, you know middle-aged 50 to 70 range where they had all this cosmetic dentistry, and cosmetic dentistry, it was a great thing, but it doesn't last forever, and now we're at a point where we have to do something else, and so you got that type of patient. So I mean, we have every age you could think
Mm-hmm.
of. And what I always find interesting too is once you get past that 70, we and you're a man too, right? So men are the hardest people when they get past 70. They're like, what do I care what I look like? They're like, it doesn't matter anymore. Who am I
Right.
trying to impress? For anybody, male or female, there usually is a reason why, and we don't always necessarily know why because they don't always tell us, but a lot of times they do, which makes this job fun because they come in with the problem of, hey, I've got this, my granddaughter's wedding or my daughter's wedding is coming up, and I want to be able to smile for the pictures, and I don't want to look back on these pictures and be reminded of my smile. And so those are fun because we get to transform them. We've got this one patient that's we did a video on, and we actually, one of our doctors went to the wedding, and it was 2 months after their procedure, and it was life changing. I mean, she was the patient was in tears afterwards because I've been talking to her for a couple of years trying to get the financing in place because when I first
Mm.
saw her, she didn't have credit, and so we weren't able to get the financing. But we worked on it for a couple of years to get her to a point where she could do it, and she did the surgery 2 months prior to her wedding and was able to smile for these pictures. We got a picture with the doctor and everything that he showed up. We didn't even know he was going, but he showed up to the wedding, and now she's done a couple other things for us. But
That's
it was
so cool. I mean, you just exposed, I think, one of the flaws in most offices is that you were able to keep track of her for a number of years. Obviously, you had some CRM or some tool to keep keep your leads active. Yeah, that's awesome, man. No, I remember the patient. I remember the story.
yeah, because
That's a quite a story. Yeah.
you guys helped with the
Mhm.
video and put it all together for us and did a great job, and it's a great video. I love to show people because, and for her, she came in and she's like, "Hey, I've got these." She was missing quite a few teeth, and she had these two kind of bigger teeth. And a lot of patients come in, they're like, "I don't want to look like Roger the Rabbit or the horse. I don't want buck teeth." She had larger front teeth, and she wanted to incorporate because she goes, "This is me." And she was young. She was a younger patient, and she goes, "These teeth have been me for 30 years, and I want to duplicate that." And so our doctors were able to duplicate having those bigger front teeth, but actually make it look really good. It didn't look like buck teeth. They looked
Yeah,
really
yeah.
good. And we were able to put those side by side, and I can show patients that, we were able to duplicate what you want. So everything's custom.
Yeah, so much of it was her wrapped up in her personality. I mean, she looked in the mirror every day and saw, and she didn't hate what she saw. She just wanted a better smile, but that doesn't mean you hate everything. What do you think the top three things that are required to do a better job at selling?
Number one is you have to have confidence. Being the treatment coordinator, I'm talking from the treatment coordinator standpoint
Mhm.
now, but from the treatment coordinator standpoint, you have to have confidence in your provider. If you go into this consultation with a potential patient and you don't think your doctor can do it, or you in the back of your mind you say, I don't know if this guy can really do this, it's going to come out. The
Mm,
patients can read you. But if you've been working for this doctor for a long time and you've seen what they've been able to do and you've been a part of that process, it comes out. It comes out in your conversation. Because I mean, I've been doing this for so long. I've been with Archpoint for 7 years, and so I've gotten to see. I mean, we got some of the best doctors that you can find. We've searched for those doctors and recruited those doctors, and I've been able to work with them and see what they're able to do and see somebody that's almost hopeless. And we've had patients come in and they're told from other doctors, they've had other consultations, and they're like, "We can't help you. There's nothing. We don't have enough bone, or
mm,
you've got too high of a smile line, or whatever issue it might be." And then I see what our doctors are able to do, which builds up on my confidence, going, "Man, they can do anything." Right. And so
yeah.
that comes through when I speak to other patients, because I've seen case by case, and I can tell them, "Hey, we can help you." Like, I've seen it
Mm,
firsthand, and I can show them the video testimonial, like this patient I told you about with the wedding, and I can show little clips of that to the patient. I'm not just making this stuff up; like, it's real.
right, right.
And then I even had my father-in-law got this done, 2 3 years ago. He got it done, and so that was a neat experience, because after doing this for 4 or 5 years, having a family member get it done, and getting to see them. He actually came and spent the night at my house, and I got to see firsthand what it's like to have somebody in your home. So I got to see somebody go through the 1 week process. Like, I started texting the doctor going, "Hey, is this right? Is this what's supposed to be going on? Like, I'm not seeing any of his upper teeth when he smiles." I'm like, "Yeah, he's still numb on the upper," and they're just walking me through it. But me going through that firsthand also helps. So you have to have
Mm,
experience and confidence in your doctors. That's number one.
yeah.
Let's see, number two. So you're being a treatment coordinator, you got to have fun, right? When you go in there, you've got to have fun, and it has to be a fun experience. But when you're talking with these patients, you're doing the legwork for your provider, and you can't expect your provider to be able to spend an hour with the patient, or they wouldn't get anything done, right? So you're doing a
Mm,
lot of this legwork for the patient, and or for the doctor, so that you can summarize very quickly what the patient wants and what the patient needs, because sometimes those two things are different, and you got to help that patient and
mm,
guide that patient down to what they actually need, right? Because somebody
gotcha.
comes in, they might have seen an advertisement, and they see teeth in a day, Well, that might mean something to different to you than it does to me. Some of these
Right.
patients, they might just need one tooth and think they get it in a day, but they don't. So you have to educate the patient and do all that legwork for the doctor and lead them
Mm,
down a path.
nice. Yeah.
The biggest thing is the third option, right, or the third point, and that is you've got to have different options for a patient to be able to make it affordable, right? And
The money problem.
the money problem is a big problem. So
Big problem.
everybody
Yeah.
wants it, right?
Hmm.
Everybody wants the procedure. It's just not everybody can afford to do this procedure. It is an investment, and those are the best patients, right? That I love the patients that spend years dreaming about this, working on their credit, coming up with a plan. Those are the ones that stay in touch with me. And it's like that patient I was just telling you about that had the wedding, right? She stayed in
Hmm.
touch with me, and we had a connection from day one, and it's not like I hounded her. She called me. She kept calling me and checking up with me of what can I do to increase my credit score. And having a banking background, I was able to kind of lead her down that path of what to do to help her credit. So it's
Mm,
not just dental. You've got to
right.
help people from the financial side as well. So you have to have, and it might not just be getting good credit and being able to pay for this whole procedure. Some patients are in dire need of dental treatment, and they can't afford to do, zirconia on their whole upper and whole lower set of teeth. So you need different options, and you need to have an option for them to get out of infection because it's dangerous for their health. And so you've got to have an option for those patients as well.
Mm,
That might be, hey, let's stage this out. Maybe it's let's remove your teeth and put you in either dentures or snap-on denture to start, and let's work our way towards the all-on-4, or different procedures that we have where we do implant bridges all the way around, or different things like that. That might not ever be an option for them, but you have to figure out what's going to be doable for them. If it's a young patient that's 30 years old, they might have a lot of time to get to that. If it's somebody that's 70 or 80 years old, time is not on their side, and we need to get them something that's going to be comfortable for them so that they can eat and not let their health degrade because they're not getting the nutrients that they need.
mm. So I mean, it sounds like from the confidence one, but from the different options to the make it affordable and solve the money problem, it really does feel like investing in the patient as a person. Why are they getting the treatments? What problem am I trying to solve? Where are they at in their life? And then how do we afford it? I mean, it sounds like caring about the patient is much more important than focusing on the I'm going to get a $30,000 case today.
Right.
Yeah.
Yeah. If you look at it just as a number and you're trying to make money at it, you're in the wrong business, right?
Hmm.
This is, you might not be able to make a lot of money, but it's rewarding, and it's the only dental treatment that where after a patient gets out of surgery, they're hugging the doctor or even the treatment coordinator. I've been asked to come in and get pictures with them because I was such an integral part of them getting this lifelong dream of getting their smile fixed, which is really cool if you think about it. You're not a salesperson. You're a really an educational patient coordinator, and
Hmm.
you're educating the patient. And as long as you look at that and you're doing right by the patient, you're doing the right thing. And that's the
Man, that
thing,
that
do the right thing.
that's so insightful. I mean, it really is an interesting paradigm because when you go out on the industry, you hear about how to get patients to yes and how to not take no, and it's all around the sales cycle side of it. And I, paradoxically, if you focus on the human being and solving their needs, you will get more sales. If you focus on the sales side, to the point, I don't like some of the things that are taught in dental today around getting patients to yes. I would very much rather be heard and have someone resolve my problems than push an agenda on me that I'm not interested in. But it sounds like, as you talk through, that's kind of what hit me about your approach is holistically caring about the individual. And I think that's really heartwarming. Yeah.
Yeah, no, 100%. So to kind of summarize everything I've said, because I've said a lot of different things, but to summarize, I know you asked me for three things, and I kind of went well, a little overboard maybe, but number one is be confident in your providers, and if you don't have that confidence, then bring in an expert. Archpoint does do that. We go to the people's office and we offer our expertise, and then two, do right by the patient. Don't try to push them into a bucket. Don't try to make them remove all their teeth if that's not the right option. Do right by them and help them figure that out. Finally, is you got to have a way to pay for it. So help that patient to find different treatment options that are affordable, and finding affordability. That might be working with third-party financing companies, or working with them to increase their credit, or finding other ways to get that credit if it's family members or whatnot, but find a way for them to make that monthly payment.
Nick, this has been so insightful and amazing, and I can't thank you enough for your time and joining me today. And that was your bite of dental marketing for the day.
Cool. Well, I enjoyed it. Thanks for having me on.